Hello, and welcome to CNOR Certification Pathway to Excellence for 2024. My name is Kimberly Jones. I am the Manager of Education and Professional Development and the LMS Coordinator for CCI. Welcome to this important topic on your path to obtaining your certification. As we get started, I want to introduce you to our education team. We have Dawn Whiteside. She is the Director of Education and Professional Development. Tabitha Kinlaw, who is our Senior Manager of Education and Professional Development. And then myself, as I said, Manager of Education, Professional Development, and the LMS Coordinator. So I do a lot with the courses that you will encounter through the program. This is a CCI disclaimer. We want to make you aware that we are this certification organization, and our role at CCI is in developing and administering certification exams to determine the qualifications of candidates for certification. CCI does not require or endorse any specific study guides, review products, and/or training courses. You have the right to prepare for certification exams with any educational materials that you choose. You can, the purchase of CCI review material is not a requirement for testing, and it does not, nor does the use of any review materials from CCI or otherwise imply the successful performance on the certification exam. CCI does offer various study resources for the certification exam, such as online practice exam, sample questions, and prep for certification courses. No study resources are prerequisites for the certification examinations. So our objectives going through this is to review eligibility requirements for the CNOR, examine elements of the CNOR exam, discuss some successful study strategies, using the recommended test prep materials, and explore strategies for answering multiple choice questions. What is CNOR? Certification is defined as the documented validation of the professional achievement of identified standards of practice by an individual registered nurse providing care for patients before, during, and after surgery. So if you look at our CCI homepage and you go to CNOR certification, you'll find this picture of the eligibility criteria. So to be eligible for the CNOR exam, you need to have a current unrestricted license in the country where you currently practice. The CNOR is not specific to the United States. We have certificate holders all over the world. Currently, you're working full-time or part-time in perioperative nursing practice, nursing education, administration, or research. You need to have a minimum of 2 years and 2,400 hours of experience in perioperative nursing, with a minimum of those hours being 1,200 in intra-op itself. Here's a nice thing that's been added with the availability of the CFPN certification. The CFPN having a CST or TS-C, or if you hold the military equivalent of those, you need a minimum of 18 months and 2,400 hours of experience as a perioperative registered nurse to be able to be eligible for the CNOR. So basically having those additional, or not additional, those different certifications, you're eligible to sit at 18 months instead of the 24. So the exam, it's 200 multiple choice questions. You get 3 hours and 45 minutes to take the exam. The exam is updated annually to reflect current resources, and there's groups. Once you become a certified CNOR, you can volunteer to sit on one of the test development groups, and part of that is the annual updating of references. Great way to stay up to date, all of those sorts of things, but it does That group does help keep the exam current, changes with practices, especially with guidelines, standards, regulations. So what resources are available for the CNOR exam? So as we look at the exam content, this is also on our website. So the exam content, the biggest part of this, if you'll notice, is 25% patient care and safety. It's huge. It's the part that we really, really do every day, every case. And then we go to the next part, which is our infection prevention and control of the environment, instrumentation and supplies. That's 16%, followed really closely behind with pre and post-operative patient assessment and diagnosis at 15%. The rest of them kind of are in the middle. Just because you see 6% and you think, oh, that's a really small number, I'm not going to dig into that with professional accountability, it's an important part. Just because it seems like a low percentage does not mean that it doesn't hold the same oomph when you look at a question. Okay, so don't ignore those as you study. Exam prep materials. So textbooks, current edition of the ARN guidelines for perioperative practice. We use Drain's Peri-Anesthesia book. That's the most current edition. Berry and Cohn's and Alexander's Care of the Patient in Surgery. Those are great resources, books that you may find in your facility library. Your educator or manager may have them. If not, see if they can get them so you have something to study with. You can rent them through various sources on the internet. So, but use the most current ones, okay? CCI has a wealth of free resources on our website, as well as available to you. So we have the CNOR Candidate Handbook. You can download it, look through it. The study plan, same thing. You can download and use it. When I sat for my CNOR years ago, I took that and I wrote all over it. I marked off, I highlighted where I needed to study. What did I not know? What did I not do well with practice exams? And it really allows you to hone in on where are your weak points as a visual. Sample CNOR exam questions are available. Of course, the CCI education staff and the credentialing team are very accessible. We like to make sure that people have what they need. We want to make sure that you have the right information and that you succeed. And then we have webinars such as this, and you'll see those on our social medias so that you can access those, listen to them as you need to, or share them with your friends who are also interested. Additional resources. PathoPhys. I'm certain that it's probably been quite some time since many of us have sat through PathoPhys course in nursing school. So do we know everything that there is to know, or do we remember everything? Because sometimes we get into a silo, right? And we just only concentrate on, why is this patient here for surgery? We don't think about everything else that's going on with them that may have an impact on their surgical process. So it's a good way to look at things and review. Medical terminology or a dictionary, to look up terms that you're unfamiliar with. Sometimes we think of language being universal when it's very geographical. And that tends to be something that we look at closely when exam questions are looked at. So I want to make sure that, if you don't understand terms, look those up. And then lab diagnostic test reference manuals, those are important because lab values vary from place to place. And now with the new NCLEX, people don't necessarily have to have those numbers memorized. They're given them on the exam. So it's kind of weighing to the side, and we really depend a lot on our EMRs and the reports that come up for labs to tell us what's normal and abnormal, but we really need to know what is the baseline. Drug references, Epocrates is a great app that you can install on your phone, and you can use it for any medications that you need to, not just for studying for the exam. And you can always check your hospital formulary if there's like a drug that you're not familiar with and you can't find it, and it's like, I don't know. AOR and Journal, great articles in there. They have continuing education that's available. AMI standards, the Association for the Advancement of Medical Instrumentation, is a great resource. It's really good if you feel like sterilization is a spot where you're really, really lacking. Go down, talk to your sterile processing manager and see if they have the standards that they can loan you to look through and study. They're very important. You'll see mention of them in the AORN guidelines. So there is like some interwoven within the resources available. And then of course the websites, Joint Commission and CDC have great information out there. And a lot of policies, procedures, references are based upon those. So this is exam prep materials that CC offers. You are under no obligation to purchase these. You are not required to use them, but I do want to share with you what we have just so that you are aware. So we have the CNOR Pocket Prep app, and that's great because you can have it on your phone. We pretty much all carry our phones with us 24/7. And so you could go into that and look through it, test yourself at lunch or breaks. They can set it to send you a question of the day every day that you go in, answer and see how you do. You can do timed tests. You can have a free version, which is very basic, or you can pay for a version to really get into it more. So there's all kinds of options with that. The exam prep, it can be purchased as a physical book or as a Kindle edition if you want that. Online practice exams, it's a 200 question time test. Great thing with this one is there's 12 months of unlimited access from the date of purchase. And then the on-demand prep course, this you do on your own time at your own pace. It covers all of the domains. And again, you have 12 months of unlimited access from the date of purchase. And then we have the bundle. So the bundle, again, 12 months access from date of purchase. You get the recorded exam review covering all of the domains. It includes the exam prep e-reader and 200 questions. So those are options, again, not required. As you go into the store more, you can see that we have spotlight courses. So we have, of course, the exam prep bundle. We have a live prep course that's going to be in a specific location. We have a virtual course that we do that's live, and it's a very big overview of the material. Okay, it's not in depth. It's not like the full course that you would go into. So those are options. We do that one day over, like 6 hours, I believe, 5-6 hours. And it's just a good resource to have if you want to participate in that. And then you get access to the course. Practice exams, but the spotlights, those are like, you go, oh, I know how to take care of managing people. I know accountability. I only really need to worry about emergency situations. So you could just purchase that for Hone In. You could purchase only the infection prevention part for Hone In. So it really, those can be cost savings. They can be supplements. It's however you want to look at this, but again, not required to purchase. So let's talk about some test taking strategies, because we all go, oh my God, this test, I've got to pass it. I don't want to do this, but I have to because I want to I want to level on the clinical ladder. I want to get a bonus, or you just want to do it because it's a good thing to do. So time-saving tips when you're studying. Do a self-assessment. That study plan that's on the website for free, download it. It is amazing to use. And I say that because I use them whenever I study for any kind of exam. You build on what you already know rather than starting from the beginning and going, where do I even start? Right? This lays it out for you, the study plan. And it doesn't matter what resources you use when you use the study plan. We give you the basic ones, Alexander's, Berry and Cone, drains, and the AOR guidelines, pretty much as references. We may link out to Joint Commission or CDC on the study plan, but those are there for you to choose what you want to use. Use subject areas to organize your study plan. So the study plan. So the study plan is divided out by the domains. So our domains are each section. So there's a domain for emergency situations. There's a domain for accountability kind of things. So intra-op care, that's the biggest domain. So really use those areas too to focus in. And then start with subject areas that either have the highest percentage of questions or are areas that are least familiar to you. So, for example, when I took my exam, I worked with an orthopedic surgeon as his first assistant. I was in the office with him. We saw patients. I went to the OR. I assisted with surgery, and then I saw patients post-operatively. I did not have full-time exposure in the ER or OR. I did not understand central sterile processing at all. I knew what to look for as far as indicators, cleanliness, checking for holes, those sorts of things. But all of the other part that goes on to make it meet the parameters of sterilization, I had not a clue. So that was the area that was like, okay, it's high on the focus percentage of questions, and that is my highest area I was not familiar with. So I really dove into that one and really zoned in my studies there. And then I looked at the intraoperative part because I only focused on orthopedics when I was in the OR. So I needed to round out my scope. Pre-op, post-op things, I had worked in various other areas. So I felt pretty comfortable as I went through practice questions on those. So really, looking at practice questions and saying, and looking at the study plan and saying, okay, this is what it covers. Yep, I'm good there. I'm good there. Oh, I need this. Will help you save some time. Study tips. Recommended study time prior to the exam is at least 3 months. Good things to do while you're studying is turn off text messages, the TV, and email while you study. Break up your content and time into bite-sized chunks. So a good way to think about this is study for 20 minutes, right? And then just stop. Take a 10-minute break, step away, and reset your brain. Because when you start really getting into these questions, you're like, and then all of a sudden you're like, oh my gosh, my brain is overloaded. I can't study anymore. Before you hit that point, you want to stop because things are not sinking in anymore. Your brain's just like, hey, I can't absorb. And if you do like 3 20-minute sessions a day, you've got an hour of study in, and you really don't feel like you've studied for an hour, but you did. Be able to apply broad concepts versus memorizing facts and figures. I can tell you there are facts that we have to know, because we should be able to answer these questions when Joint Commission comes through and says, what's the temperature and humidity range for the OR? What's the temperature and humidity range for sterile processing, for your sterile supply storage? What are, various factors like that, those we just have to know. Okay, but it's not like don't memorize every single fact. You need to take that information and be able to apply it to a situation, because those are how you're going to remember those. And then practice by taking multiple choice style exams. And just repeat those questions. And if you keep missing a question, one thing I always told folks as a CNOR coach was cover up your answers when you're practicing before you even read the question. Just slide a piece of paper up on your computer screen or over your phone, whatever, and read the question. Test your brain to see if the answer that you come up with is one of them that would be given to you. If it is, you probably pretty right. If not, then look at your answer option choices and say, okay, I'm going to choose this one. And then find out, are you right? So that practice method will really help you as you go through for study. So let's look at analyzing multiple choice questions, because there's some good information if you understand how to read questions. So components of multiple choice questions. So we have the STEM. The STEM is basically the question. Okay, it's going to give you all the information needed to answer that question. It will not typically give you more information than you need. The question can either be open-ended, where you're going to fill in the blank or complete the sentence, or it's going to be a closed-ended where the sentence, the STEM ends with a question. And then your options. So you're going to have distractors. Distractors are plausible. They could be right, but they aren't, because the key is the correct one. Okay, so you have options that includes one key, and then the rest are distractors. And your STEM is going to give you all of the information you need to answer that question. So there's always 4 options, and you only have one correct answer. They're not set up to trick you, but it's to test your knowledge, okay? The other 3 options are distractors. They're possible, but they're not correct. And there's something in that just says, nope, that one's not right. Okay, there is no true false, there's no multiple, and there's no calculations requiring a calculator on the CNOR exam. So you can take a big sigh of relief and go, oh, thank you. There are no pictures, no diagrams to label. Pay attention to keywords such as first, best, and most. So looking at some test taking errors. One thing as a CNOR coach that I noticed in helping people was they read into the STEM. Why do they read into the STEM? Because they overthink. They've got experience beyond 2 years, or they're like, well, but here we do this and here we do that, right? And so they read into it, they overthink. I actually had somebody that I was coaching, and they kept missing a particular practice question. So they finally called me in and said, why am I missing this? And so I covered up the answers and I said, read this question. I said, now what's the answer? Well, it's this. And I said, why? Because that's what we do. Well, because that's what we do in our facility is not what is the correct answer. We may be kind of on that cusp of being correct, but we aren't quite there. If we take too much time on a question, right, we really are just sitting there stewing about it and going, I don't know, and debating, and we lose track of time. Well, what happens then? We get rushed to catch back up, or to go, oh my gosh, I got to finish. I'm running out of time. So really keep an eye on how much time you take per question. That's where timed practice exams can come in handy for you. You missed the quantifier. First, most, best, important. Those are good keywords to think about. And then typically when people change their answer to a multiple choice question, they had the answer correct the first time. If you go back and read it and you're like, yeah, no, this I'm certain this is it. You know, if you're standing on that fence post going, I think it's this one, I can't decide, and I think it's really this one, but I'm gonna choose this one because it sounds better. Typically not the best choice. And then people expect to see the same questions on the exam that were on the practice exams or other prep products that are out there, and they'll say, oh, they got that question. They may be similar, but they are not the exact same questions, okay? There may be similarities, I should say, not being similar. So practice questions are great. They get you used to the style of the questions, but they don't give you the questions. Another test taking error is, like I said, answering the questions based on your past experience. Okay, so what we do here is not necessarily the correct thing. It goes back to the old adage, why did you do this? Well, because that's the way we always do it. Well, is that the best way? Maybe not, right? Example would be rolling blankets and pillowcases with an IV bag for positioning device. Is that the best practice? No, we use gel positioners. So think about those. Facility present practice may not be evidence-based. That kind of goes along with this, answering it on past experiences. In school, we're taught to take tests by tricks. Tricks being choose option B, choose the longest option or the shortest option. But instead, you really want to analyze the options in regards to the question. Do they fit together? Are they written so that it flows together and makes sense? And that comes into analyzing, okay, what am I thinking about with this question? What are they really asking me? Don't read into it. What did you need to know to answer the question? Were you unfamiliar with the content, and where would you go to find more information, right? Would you go to the AORN guidelines? Would you go back to Berry and Cones or Alexander's? Would you go to Joint Commission or CDC? And when you're doing your practices, find out if you keep continually finding the wrong answer. Why was that option incorrect? And that will help you learn why the correct option is correct. So we're going to take a look at some sample questions. And so here's one. I'll let you read through this and your answers. Is the patient population which accounts for the greatest number of eye muscle procedures is which option? I'll give you a second to think about that. And here's our answer and rationale. So it's pediatric. I'd be curious to see by a hand raise, how many of you got that correct versus incorrect? And I'm going to guess that if you got it incorrect, you went with geriatric. And the reason you went with geriatric is because of eye. So here's a couple of things. Your quantifier, greatest number, okay? And then you have muscle. So you have eye, and we kind of tend to skip over words, right? We read the sentence, but we don't read every word. Our brain fills it in. So we see eye procedures. Well, we think, oh, well, we always do cataracts. Good gosh, of course it's that. But it's not, because it's greatest number, muscle. Which group has muscle procedures on their eyes typically? It's the pediatric ones, right? Which matches up with the rationale that's provided. So that's a key to look at that question and break it down. Next question. Most effective way to evaluate a patient's comprehension of their upcoming surgery is to, and we're going to complete this because it's open-ended. So I'll let you look at these choices. And so here's our answer and rationale. So the correct answer is highlighted. You pretty much know that documenting or witnessing the signing of a consent form really doesn't evaluate comprehension, doesn't evaluate understanding, right? Asking yes and no questions, nope, it sure does not. So documenting that the patient has received a patient education brochure, does it evaluate their understanding? No. Does it document that they received education? Yes. But to have them describe the procedure So one good question, you know, that you think about is, well, I always ask my patient, what are we doing for you today? Or are we taking, if you say, are we taking out your gallbladder today? Well, then you've taken away that evaluation of their understanding. Just a difference in terminology. So think about those things. And then here's the last question that we'll go through on this is the perioperative nurse discovers that a sponge is missing during the closing count for a left lung lobectomy. The nurse's first action would be to what? And I'm going to guess that you're wavering between A and B. So why would you pick B? Because typically, you know, if you say, well, you're going to repeat the count, yes. But if you don't let the surgeon know why you're repeating the count, because now you've pulled the scrub person back into being in the count and they shouldn't interrupt, and that you're busy doing a count again when you just did it. If you notify the surgeon and say, hey, I'm missing a sponge, I'm missing this, then they can start doing their methodical wound exploration, right? They can start looking for things and seeing. And they can also then become more involved in, do I have something hidden somewhere or laid up here and it fell underneath a blue towel or it's wrapped in the drape. So it then gets more activity to prevent any RSIs. So those are the way that questions will be written that you will be seeing, okay? You will not see these exact questions on the exam, promise. So how do you apply for and what are the fees for taking the CNOR exam? So the first thing you have to do is, oh, there's a quantifier, is establish a CCI account. Go into the website, create a CCI account, and then you're going to apply online. Okay, and that application button is all over the front page. It's in a lot of places. So you want to apply online. This website here will take you to the application process. And one of the first things it says after it tells you about the process is to create an exam, or an account. You're going to pay your fees. We do random audits. Those do not only go for once you have your certification, but we audit the applications. We want to make sure that people meet the criteria that's been established to sit for the exam. Just because you apply and put in your money does not mean that you are qualified to take the exam. So we really make sure that things meet the standards that we've set. And then you choose your test date and site once you've been approved and you get your authorization to test. And our testing agency is PSI. Okay, so that's who you would arrange all of that through. So what are the fees and payments? So as you can see on here, there's two prices. What's the difference? So the price of the exam is $445 currently. And prices are always subject to change, so I'm going to throw that in there just so you're aware. So currently it's $445. We offer a take two option for $50 more. Okay, so what's the difference? Price of the exam is you get one shot, but this exam, any certification exam, tends to make people very apprehensive for the most part. And it's almost like the take two is a security blanket, is the way I think of it. It gives you the option to have a backup test in case you're not successful on the first attempt. Okay. And it's $50. If you do just the single exam and you're not successful, then it's another $445 that you would pay to repeat the test. So you can't say, hey, I took it, I want to add $50 and take a second one. It doesn't work that way. It's either you put the extra 50 up front, or it's more to repeat. So it's a great option. I wish it would have been available back in the dark ages when I sat for my exam, but it wasn't. And And I really like that it is. And you absolutely have the right to choose whichever way you want to go with this. I'm not pushing one or the other. I just want to make you aware of options that are available. And then here's some more options that you have available with the exam fee. So again, you can have the single take exam. You can do a take two. You can do a single take with the exam prep book. And then you can do the take two with the exam prep book. So lots of options. Nothing in this presentation is required or will guarantee you success in passing, but we feel like that it gives you options, will help you formulate a study plan so that you are successful. We're here to help guide you, give you information, and be successful. That's the important thing when you start this process. So with that being said, I want to thank you for your attention, for pursuing the CNOR exam, if that is the path that you want to take. And again, thank you and have a great day.